Good morning to all. Here Ganesh Patidar, Associate Professor, Sage College of Nursing, Sage University, Bhopal. Today I'm going to discuss about bone marrow transplantation. Bone marrow transplantation, it is also known as stem cell. So first, we should know what is bone marrow. Bone marrow is the soft spongy tissue that fills the core of larger bone. It serves as an active function in the body by producing all three types of cell. Which are the all three types of cell? RBC, WBC, and platelet. So RBC here carrying oxygen throughout the body and it's provide oxygen to the all the cells and tissue. WBC which fight against the infections and platelet which manage the bleeding. What is bone marrow transplantation? Bone marrow transplant is a procedure used to treat patients with life-threatening condition like blood disorder, immunological disorder, or genetic disorder. This includes like leukemia, we can say it is a blood cancer, and bone marrow cancers. A bone marrow transplant replaces the unhealthy blood-forming cell with healthy ones. Healthy bone marrow stem cells are harvested from matching bone marrow donors. So there is a technique, the bone marrow or stem cell collected from the patient itself and from another individual also. We can say it is autologous and allogenic transplantation. So what is here genetic disorder? It is a health problem caused by one or more abnormalities in the genome. Next, what are the indications for the bone marrow transplantation surgery, in which condition the stem cell transplantation is done. So bone marrow transplant is done to treat a number of cancer and non-cancerous condition. Cancer means we can say it is an abnormal growth of the cell. First, here we are going to discuss about the leukemia. What is leukemia? Leukemia, we can say it is a cancer of the blood forming tissues or cells. Second one, there is a lymphoma, cancer of the lymphatic system, multiple myeloma that develops from the plasma cell in the bone marrow, and uh, dysplasia. Myelodysplasia, it occurs when blood cell poorly form or don't function properly. Non-cancerous condition like aplastic anemia, hemoglobinopathies, and there is a immunodeficiency disorder and condition affecting blood present from the birth. So here we are going to discuss about what is aplastic anemia. It is a serious blood disorder. It occurs when the bone marrow doesn't make enough all three types of blood cells, RBC, WBC, and platelets. And hemoglobinopathies, it is a genetic disorder which affecting the structure or production of the hemoglobin molecule. Next, we are going to discuss about the transplantation process. So, what is transplantation process? So, there are two processes. There is a autologous transplantation process, and second one there is a allogenic transplantation process. So, first we should know what is autologous and allogenic. Autologous, we can say it is a cell or tissue taken from the ओन टिश्यू और सेल मतलब मैं खुद पेशेंट हूँ और मेरे खुद का सेल और टिश्यू लिया जा रहा है ट्रांसप्लांटेशन के लिए तो वी कैन से इट इज अ ऑटोलॉगस सेकंड वन देयर इज अ एलोजेनिक तो व्हाट इज एलोजेनिक एलोजेनिक वी कैन से देयर इज अ सेल और टिश्यू टेकन फ्रॉम अदर इंडिविजुअल ऑफ द सेम स्पीसीज मतलब वी आर ह्यूमन बीइंग और मैं ही मेरे को यदि ट्रांसफ्यूज करना है इन्फ्यूज करना है स्टेम सेल तो किसी और ह्यूमन बीइंग से लेके मेरे अंदर इन्फ्यूज किया जाता है मतलब डोनर से किया जाता है तो वी कैन से इट इज एलोजेनिक सो व्हाट इज दिस प्रोसेस कलेक्शन प्रोसेसिंग क्रिप्टो प्रिजर्वेशन इसके बाद में कीमोथेरेपी एंड लास्ट वन देयर इज अ री इन्फ्यूजन सो वन बाय वन वी आर गोइंग टू discuss about all the five things so first one there is a collection. So what is collection? Collection, it is a stem cell are collected from the patient bone marrow or blood. Means the patient itself, bone marrow, the stem cell are collected. What is processing? Processing means bone marrow or peripheral blood is taken to the processing laboratory where the stem cell are concentrated and prepared for the freezing process. So this is second process of the transplantation processing. Third one, there is a crypto preservation. Crypto preservation means the cell are preserving in the freeze. Bone marrow or blood is preserved by freezing. We can say it is a crypto preservation. The word itself defines to keep stem cell alive until they are infused into the patient's bloodstream. Fourth one, chemotherapy. High dose chemotherapy, or we can say radiation therapy, is given to the patients. Or last one, there is a reinfusion, means whatever the stem cell are there that we are infusing to the patient. So the stem cell are infused into the patient. So this is the autologous process. But here there is a difference between autologous and allogenic. In autologous, the cells are taken from the same individual. मतलब patient से ही लिया जाता है bone marrow. So we can say it is a autologous. And here there is a allogenic. The process is same, but here the stem cell are taken from the donor. So this is the difference between autologous and allogenic. So from where, what are the sources of this stem cell? So we can collect stem cell from the peripheral blood, we can collect from the marrow, or also we can collect from the umbilical cord. So this is about stem cell transplantation. Thank you. Regards.